Dear Deputy Presiding Officer, I'd like to thank the Minister for a pre-advance copy of the statement today, and I do acknowledge the publication of the Welsh Government's Mental Health and Wellbeing Strategy for 2005 to 2035, and all the work I know that has gone into it over the time through previous ministers in this portfolio, and it is positive. But while the strategy does outline a broad positive vision, and I welcome that, it is vital that we do move past the headlines, ambitious, and focus on how this will be delivered in practice, because I think that's really important, because for too many people across Wales, access to timely mental health support, as I spoke about earlier, is a struggle. That's why I brought forward my own mental health standards of care Wales bill, to embed that accountability and improve access and ensure consistency right the way across the service across Wales. That bill comes from extensive engagement with frontline professionals, service users and families who've all had to navigate this framework and this system. And I think it's nice to see some of that coming forward within the strategy as well, of how we're actually going to improve some of these things. But Minister, I'm interested in the commitment you made to saying open day access mental health services. It does sound promising, but the strategy doesn't give the detail around those. When will this be available, and in what areas is it going to be available? And I'd also like to know, Wales doesn't just have urban areas, it has the rural areas. And I want to know, is this service going to be equally applied to our rural areas as well, not just the urban centres? And how will you ensure that people can rely on this support, all the time, not just in theory, but actually there all the time so they get it? You also mentioned about early adopters and pilot schemes. We have seen far too often, haven't we, and you knew this from when you was on the back benches as well, that these can lead to postcode lotteries and some people missing out. And people's access to mental health support shouldn't depend on where their postcode is. It should be about what they can get and how they can get it, and not from how far they live from a pilot area. So I'd just like to know, when you have these pilots in place, how are they going to be expanded to make sure that no one misses out on these pilot schemes? I also know, as you mentioned towards the end of your statement, about the strategy shift from a health-led to a social care model. And while I agree with that in principle, I do question the capacity of local services to meet this challenge. We all hear across this chamber about the challenges within social services. It's already under huge pressure. An integration between these two systems simply just can't mean passing more responsibility over to overstretched local authorities without the necessary investment. So I'd be interested to know how that investment's going to look and how those integration is going to work in practice. Because I think, saying it's one thing, but actually delivery is another. One thing I talk about a lot about in this chamber is about accountability. And the strategy talks about co-production and lived experience, very important elements. I'm keen on that myself. But there is a bit little clarity on who will actually be held accountable when things do go wrong. If we understand not everything's going to work out perfectly, there are going to be times when it does fail. So we'd like to know who is going to be held accountable, because we need to see published targets, annual reporting, and mechanisms as well for this Senate to be able to scrutinise progress properly. It's lovely having internals reviews within Welsh Government and hopeful language coming out in statements, but it's actually the meat of actually this Senate getting underneath it, scrutinising it and making sure it's working. The strategy is very good. I've said I welcome it, but no strategy can work without an appropriate workforce, and it can't be delivered without them. Mental health professionals, as you know, are telling us across Wales that they're understaffed, under-resourced, and recruitment is a real issue. So I'd like to know what is being done to retain and build a stronger workforce so we can meet these expanded goals. And finally, Minister, an issue I'd like to raise with you is the issue about peer mentors for our veterans across our health boards. They do a great work supporting our veterans, the ones that we currently have, not in every health board, mind, of supporting teams to actually understand the issues that veterans face with regards to their mental health. They do have individual challenges for the experiences they've seen in some probably the most challenging parts of the world, keeping us safe. For the investment in every single health board, that would cost $450,000. It's actually a very small amount of money for the actual great work that they do in supporting veterans' mental health. And I think it'd be lovely to actually hear on this anniversary date of VE Day whether the Welsh Government will commit to putting that £450,000 in place to support our veterans community across Wales. And in closing, Deputy Presiding Officer, I want to be clear that we all want to see improvements to mental health services and wellbeing across Wales. You know, I get encouraged when I see stats, you know, saying there's improvement. I'm not one of them politicians that doesn't want to see things improved. I really, really do, because that's what we're actually here to do, is represent our constituents and make sure things get better. But we need to have more than a vision. We need to have deliverable, measurable change and proper scrutiny. And I hope the government will work closely with members in this chamber, including those of us who have brought forward mental health legislation in the past, to ensure that this strategy doesn't just deliver, but it actually creates the best mental health and support systems that we can have in anywhere in Europe. So, Deputy Presiding Officer.
Thank you so much, James Evans, and I always acknowledge, honestly, the tremendous amount of work that you've done in this area, and always welcome your contributions and questions, and please, ongoing work around all of this, especially in the areas that you represent as well. So I just want to absolutely reassure you that we have the 10-year strategy, mental health and wellbeing strategy, but we also have now a very targeted, specific 3-year initial delivery strategy. And I think it's very comprehensive and then aligns very much with the actions, who is accountable for it, and also the timeframes for that delivery for those first 3 years, so we can really get this going. So just to say, as you will be able to see in the Q1, is the very first action points that we have. Straight away now, we're going to be establishing a joint ministerial advisory board with terms of reference that set up the relationships with other structure and organisations and that clear reporting framework. I'll be doing that alongside my colleague, the Minister for Children and Social Care. So that's within 6 months. We're also then going to ensure that we publish a closure report outlining the achievements against the Together for Mental Health report to set that baseline for the new strategy. So we're not completely abandoning the work that came before. It's always important that we learn those lessons and we build upon it. So much good work in that. We will then be publishing an outcomes framework and theory of change that will support the commission of an independent evaluation and strategy. We're not marking our own homework on this. This will be an independent evaluation. And then we will also be publishing annual updates against the actions in the plan. As part of this process, we will look to review progress and will detail any additional activity that we think is necessary to deliver against these priority areas. So I want to absolutely assure you, taking this very seriously, I would not be prepared to make this commitment to the people of Wales unless I was confident that we had the accountability and governance structures in place to absolutely ensure that we deliver this. I will not say that we will deliver it overnight. That is not what we can do here. What we can do, though, is that we can look at what we already have and we can really now start to refresh and start to manoeuvre and move it into a much more stepped care model that is holistic and that is going to help people exactly when they need it. So many of you will have groups, I know I do in my own community, who have said to me, gosh, you know, the last strategy over the 10 years, we've done so much to reduce stigma. And that has largely been because of people sharing their lived experience. And through doing that, now we've said to people, right, go and speak to somebody, ask for help, reach out. And they've said to us, when we did, it wasn't there. And so I think that that's the other thing, is that a lot of people will go into their primary care and then they'll have a chat with somebody, and sometimes they'll be put on a waiting list for some counselling sessions in maybe 3 months and maybe 6 months. This is sometimes what is happening. And what we know is that often people only then go to that first session for the counselling. Now, that could be because it wasn't there when they needed it, because you need it when you need it. You need that initial kind of conversation with somebody so that they can do an assessment, and that's what the step care model is. It's about being able to do that assessment, that initial intervention, and ensuring then that you go to the right service. It's about prevention. We don't want people escalating. We want to get them the help and support exactly when they need it. I also want to say that, there has been a huge amount of enthusiasm about this. It has taken 18 months, but because of that, co-production isn't fast. I'm looking at my predecessor, Lynn Eagle here. Co-production isn't fast. I'm carrying on the work that you started 18 months ago, but it's so much better because it's really meaningful and it will really reach the people we need to reach, and you really bring everybody with you. So what I would ask is that as we go forward now, that co-production has to continue. And it's not quick, but it's going to be so much better when we embed it. And I'll weave in here as well what you said about the workforce. So alongside this, we have the strategic mental health workforce plan. But as I mentioned, the NHS executive, who will be leading on ensuring that this is delivered now, did a fantastic session with mental health workforce recently. This is the kind of care they want to be delivering. There was so much kind of optimism about it, because this is exactly what they want to be able to do as well. So that's going to go such a long way in getting this implemented. No postcode lottery. This is why we have made the ambitious commitment to make us the first country in the world. I'm 99% sure. I've thoroughly searched this, to do this on an all-nation basis, because we do have models of this already happening. I went to Merthyr Tydfil College recently with my colleague, the Minister for FE and HE, and they're doing it there. You go in, there's a beautiful big sign for Wellbeing, a whole centre. You can pop in there, you can get some resources, you can have a chat with people, you can feel connected and better. If you need some help, they have a commitment where they will get you somebody to have a chat with you, and the most is 3 days. And not a single young person that I spoke to there had any qualms or any stigma or any shame about saying, my mental health isn't great at the moment, I need a bit of support. That's what I want on an all-nation basis. So the purpose of this is that no more postcode lottery. And then I also wanted to say that this is really, like I said, you mentioned local authorities there. This is local authorities, this is RPBs, this is the voluntary sector, this is the third sector. This is so many organisations coming together and always keeping that lived experience coming through. So I do feel the accountability and governance is very much there. It's going to be very much evidence-led, building on the work that's gone before by the now Cabinet Secretary for Education. And we're really going to monitor this. And please hold us to account over it, because I'm absolutely determined that we're going to be the first nation in the world that really does this. Oh, and the veterans, sorry. Yes, so the peer support for veterans, I'm really, really passionate about this. I went to the event that was hosted by Darren Miller in the Peer Head last week. I got to hear from many of the peer mentors across the health boards. I mean, just having that kind of support where you speak, you speak in the same way, and you really kind of, there's an unspokenness about it, the support that you get. Look, I want it across every health board, but it is on the health board to make the assessment of the needs of their communities. So we already have health boards who do this. I want the other health boards to do it. I won't commit to the additional funding for that until I can have a clear assessment of why those health boards are not doing it. Because if there are needs of veterans in their health board locality, then they should be providing that support. And also what I would say is that Laura Ann Jones has been very good in raising awareness of the Female Veterans Alliance, and that was money that was given by Welsh Government to those pilots. And I'm actually going out to West Wales to meet with, we think, the first and only female veteran peer support mentor, and I would also like to see that grow as well. Diolch.